My name is Shane, I'm president of Symptomly. We're a mobile health company. Imagine for a minute that you're sleeping peacefully in your bed at night. It's 2 a.m. in the morning, you're fast asleep. Then all of a sudden one of your kids runs into your room. Daddy, Daddy, Jackson can't breathe. He can't breathe, Dad. You jump from your bed and run to his room to find your little boy having an asthma attack. You grab his rescue inhaler and give him a few quick rescue breaths, but nothing changes. So you pull him out of bed, throw him in your car, and the two of you haul off up to the emergency room as quick as you can. Three missed work days, and $10,000 later, the two of you finally get to come home. This is my neighbor Jackson, and this is exactly what happened to him 11 months ago. There's 2.1 million little Jacksons in this country that suffer from asthma and will be admitted to the emergency room or hospital as a result of asthma. The saddest statistic is that 40%, almost half, will be readmitted because they can't manage their symptoms. There is no cure for asthma. However, it is preventable. Let me introduce you to Asthma Tracker by Symptomly. Asthma Tracker is a symptom management system designed to keep kids out of the emergency room. In a $2 million study conducted at the University of Utah, 98% of the patients that used Asthma Tracker stayed out of the ER and were not readmitted. Let me repeat that. 98% of the kids who used Asthma Tracker were not readmitted to the hospital. Those numbers are huge. Asthma Tracker is a tech commercialization deal from the University of Utah. They've spent over $2 million in research and development validating this tool. Together we've partnered with Intermountain Healthcare and Primary Children's Hospital to roll the system out to hundreds of patients. So what exactly is Asthma Tracker? For Jackson, he or his mom logs into the system once a week. They answer a series of questions based upon the asthma control test, and they're given a score. If that score is low, the system recommends that Jackson get in to see his pediatrician. At the same time, he receives a notification via email and text message telling him that his asthma is not very well controlled and to get in to see the pediatrician. So Jackson gets a notification, his mom and dad get a notification, and more importantly, his pediatrician, Dr. Strasser, gets a notification. Never before has a pediatrician been able to monitor her asthma patients as they're away from her clinic. We talked to scores of pediatricians, and they said that their number one frustration with asthma patients is that they never hear from them until it's too late, until they've already had an asthma attack. Asthma Tracker changes that. For the first time, Dr. Strasser can log into our system. She has 200 asthmatic patients, and she can quickly review which ones are doing well and which ones are performing poorly. She can reach out to those that are struggling and get them into her clinic so she can adjust their medication appropriately. Asthma Tracker is a game changer for pediatricians. Dr. Chris Maloney, the professor of pediatrics at the University of Utah, has said that this is a quantum shift in modern medicine and patient care. And Vivian Lee, the CEO of the University of Utah Health Systems, has said that Asthma Tracker is shaping the future of asthma care. I mentioned that IHC, we're working with them, and they've rolled out the product to hundreds of patients. Why do they care, and why are they interested in Asthma Tracker? It's simple. They're an integrated healthcare system. That means that they provide patient care and patient insurance. And it's insurance companies that stand to gain the most financially from Asthma Tracker. Let's look at some statistics on the Children's Health Insurance Program for 2010. We spent $228 million on ER visits alone for child asthma. We spent another $198 million on hospitalizations and $79 million on readmissions for a total of $505 million. With Asthma Tracker, we can cut the top two in half and virtually eliminate readmissions, saving the CHIP program $290 million in 1 year. That's our value proposition. CHIP Idaho and the Colorado Health Co-op both love those savings, and that's why they're on board. Their patients, they will be paying $10 per asthmatic patient per month to use our system. And Arches, who introduced us, their mission is to close the communication gap between physician and patient. And Asthma Tracker does exactly that. We have 20 clinics up and down the Wasatch Front that are using Asthma Tracker. And this is a big deal. Remember my neighbor Jackson? I'm happy to report he's got 11 straight months without an asthma attack. However, that's not to say that he hasn't gone without incident. He's actually been in to see Dr. Strasser 3 times in that time frame. Those 3 visits represent 2 things for the clinic: improved healthcare and increased revenues. That's why clinics are paying for our system. Our first channel partners in Alliance Health Networks, they have an asthma community of thousands of members. Just Friday, they agreed to push Asthma Tracker to 1,000 of their members in the next 30 days. So, just to make things perfectly clear, Symptomly is our company, and Asthma Tracker is our first product. The Symptomly platform is scalable and can easily expand into any number of different verticals and chronic illnesses. Our customers have already requested that we move into the COPD and diabetes spaces. So, just how big is the market for Symptomly? The total spend on child asthma last year was $56 billion. But we're not interested in the total spend. We're interested in the ER visits and hospitalizations. And that market size is $3.6 billion. I've already told you that our customers are asking for COPD and diabetes modules. Well, those market sizes are $3.5 and $7 billion respectively. My team is world-class. My name is Shane. This is my 7th startup. My last startup was Campus Book Rentals. We took that company from 0 to $35 million in revenue in 5 short years, which put us number 17 on the Inc. 500 list. I left that company in November to start Symptomly. And with this team, we're going to 10x what we did at Campus Book Rentals. The future of healthcare is now. We all know that opportunity is born in turbulent markets. And the healthcare system is ripe with opportunity. I'm Shane Willard, co-founder of Symptomly. Join us as we build the future of mobile health. Thank you. Yeah.